I am Tiffany Richards, and I am a nurse practitioner at MD Anderson Cancer Center in Houston, Texas. And I'm excited to talk to you today a little bit about Sarclisa or isatuximab. Now, when you're starting on treatment with isatuximab, and one of the things that I always tell my patients is it is what's called a monoclonal antibody. And so a known side effect with monoclonal antibodies are infusion-related reactions. And so nurses in your infusion therapy center are used to giving monoclonal antibodies. We use them in lymphoma and in other cancer types. And so they're very familiar with it. But I think as a patient, it can be scary if an infusion-related reaction occurs. And so one of the things that will happen is that you will receive pre-medications prior to the infusion of the isatuximab. So they'll give you some Tylenol, they'll give you Benadryl. At our center, we also add Pepcid and Singulair to that. And then you'll also get dexamethasone. And so those drugs just help to prevent that infusion-related reaction. Now, the first time you get it, they're going to start the infusion off slowly, and then usually every 30 minutes, they're going to increase how fast the rate of that infusion to make sure that you're tolerating it okay. Now, if at any point you start to show signs and symptoms of having a reaction, then they are going to stop the infusion. They'll give you some more medication, and then once your symptoms resolve, they'll restart at a slower dose, at a slower rate, and then gradually increase it back up again. And so you may be asking, like, what are the signs and symptoms of having an infusion-related reaction? It could be a fever, it could be chills, it could be difficulty breathing, it could be a drop in your blood pressure, some nasal congestion, as well as some nausea. I usually tell patients if you start to feel funny, if you have any symptoms during the infusion, just let your infusion therapy center nurse and let them make a determination if it's from the isatuximab or not. Now, the first time you get it, I always tell my patients, plan on being at the infusion therapy center all day. Just so that if you get done early, you don't have any problems, great, you get to leave early. But this way, at least you're prepared. So, bring a blanket and a book so that you have something to do while you're getting that infusion. But the infusion-related reactions, I think, are the most scary for patients. Other side effects with it is sometimes we can see a decrease in your blood counts, and then it can also place you at risk for an infection as well. So one thing that can happen with isatuximab is it can make it more difficult for the transfusion medicine team to make sure that your blood and the donor blood is compatible. So oftentimes, if you do need a blood transfusion, it may happen the next day. The other thing is it's really important that you make sure that you leave your oncologist's office with a wallet card that provides instructions to an emergency room in the event an emergency transfusion is required. Otherwise, most patients tolerate it really, really well. I would say that probably for most patients, once they get through that first 2 infusions, they do fine. And really, we don't see a lot of added side effects when we combine it with bortezomib or lenalidomide and dexamethasone or carfilzomib or any of the other drugs. We really don't see a lot of added side effects, with the exception of the infusion-related reactions. A little bit more, there's some more risk of infection, and then a slight tendency to more decreased blood counts. But otherwise, you really shouldn't have any added side effects, which makes these drugs a great option for patients, even in our patients who are more frail.